So up next, we have Team NIMBS, who collaborated with Mr. Prince Mtentha-Anga from Queen Elizabeth Hospital in Malawi. One thing that I really admired while working with Team NIMBS this summer was their perseverance throughout the engineering design process. Their project had a lot of unique design challenges that they always tackled with enthusiasm, while also really humbly accepting feedback from others. So I'm really excited for you to see the work from Team NIMBS right now.
Over 1 million. Every year, over 1 million newborns and children die due to premature birth complications. These concerning numbers emphasize the dangers of overlooked prematurities. When small and sick newborns are born in low-resource settings, their gestational age must be quickly determined to provide them quality care and to prevent further newborn deaths. A newborn's gestational age is often identified by using ultrasound technology or a mother's menstrual history, but these tools are not accessible in low-resource countries like Malawi, where this problem was brought to our attention. The common reliance on birth weight to determine gestational age is also not reliable. Instead, the most reliable method is the new Ballard score. The new Ballard score is a series of 6 neuromuscular and 6 physical exams that a nurse can perform to determine a newborn's gestational age. However, many nurses do not receive sufficient training to properly perform the score, especially when it comes to the 6 neuromuscular exams pictured here, where they have to carefully move a baby's arms and legs. Here is an example of a Ballard sign, the popliteal angle. So currently, the Ballard score is covered in a single lesson during nursing school, and it's taught primarily through picture diagrams and videos like these instead of actual hands-on practice. And currently, there is no hands-on training model for nurses to practice on, which is where our project comes in.
My name is Andrew, and my teammates are Gloria and Lam. And our project aims to address this issue. We created NIMBS, which stands for Neonatal Instructional Mannequin for Ballard Scoring. NIMBS is a hands-on training mannequin that nurses and nursing students can practice new Ballard scoring on before they move on to actual infants. We hope that our device can support clinicians in identifying prematurities and providing quality care to newborns. NIMBS seeks to simulate what nurses would see in the neonatal ward. Thus, we wanted our device to look like an infant and have full range of motion in its limbs. Additionally, we incorporated adjustable resistances and recoils in the arms and legs so that NIMBS can simulate the muscle tone of infants of a variety of gestational ages and maturities. So here is the same popliteal angle now being performed on our mannequin. As you can see, the trainee would extend the infant's legs until they feel resistance, which in our model is being provided by a taut string.
As Andrew mentioned, our top priorities were incorporating complete range of motion, adjustable flexibility, and realistic appearance. Our mannequin's leg has a 3D printed bone structure that shows full range of motion, and adjustable flexibility in the knee is provided by a string and dial mechanism. Lastly, this is all surrounded by an outer encasing that gives the leg a realistic appearance. Our mannequin's arm also has a 3D printed bone structure that provides the full range of motion with outer encasing to provide a realistic appearance. The flexibility of the wrist can be adjusted by another string and dial system, and flexibility in the elbow can be adjusted by a spring and screw system for the angle of recoil. Our device successfully conveys the visual appearance and range of motion of an actual infant. Our training mannequin can demonstrate 5 out of 6 total Ballard signs. In the future, we plan to implement the 6th Ballard sign, scarf sign. We also intend to experiment with materials, with different materials to give our model a more flesh-like feel. Once our device is completed, we intend to conduct user testing and then eventually hand it off to our client to implement and practice in Malawi. In summary, the new Ballard score is crucial to providing newborns with quality care. Our goal is to prepare nursing students to practice the new Ballard score more accurately and frequently, further enabling clinicians to provide critical care to newborns. Lastly, we would like to acknowledge our client, as well as all of our mentors who helped guide us through our design process.
Any thoughts about calibrating the model?
Yes, so our model currently has not been calibrated, and it's not our main priority. First, we want to make sure that our model can exhibit the signs and be able to model different gestational ages. However, that is a future consideration, and it's definitely possible with the dial. We were thinking of printing, perhaps, different markings for different gestational ages on the dial so that our model could be very easily adjusted for that.
I'm curious if the string is easy to break, and if that were to occur once this model's in Malawi, is it something that they can repair easily?
So the question is, what happens if the string breaks? That was incorporated into our design considerations. The string is extremely easy to replace since the dial is removable. So once the string breaks, with some simple instructions, another user could come in and rethread the strings through the holes that we have incorporated in our model and reassemble the dial without any specialized tools.
To add more onto that, we met with our client, and he addressed to us that when the Ballard score scoring is performed, there's not excessive force. It's extremely gentle. They practice on it like they would in a real infant, so it is not likely that the strings will break.